Hi, I am Dr. Chaitanya, an internal medicine specialist from Hyderabad. And today we are talking about one of the most important yet most ignored threats to your health, insulin resistance. Insulin resistance is the foundation of many chronic illnesses, diabetes, PCOS, fatty liver, even heart disease. But most people have never heard of it. So what exactly is insulin resistance? Imagine your body is like a house and insulin is the key that opens the door, which allows sugars from your blood to enter into the cells to be used for energy. But in insulin resistance, the key doesn't work anymore. The lock is jammed and the sugar stays in your bloodstream. And now your pancreas has to pump more and more of insulin just to get the job done. Over time, your body becomes flooded with insulin, but the sugar isn't entering your cells. Your blood sugar level rises. This high insulin state leads to weight gain, fatigue, brain fog, and craving, and eventually full-blown insulin resistance and diabetes. Here's the scary part. You can have insulin resistance for years without knowing. Your fasting sugars may be normal, but inside damage is building. So how do you know if you might have insulin resistance? Here are some red flags. Constant fatigue, especially after meals. Belly fat that won't go away. Brain fog, low concentration. Recurrent craving for sweets and sugars and carbs. Darkened skin fold, especially in the neck, called acanthosis nigra. If you have 2 or more of these, it's worth checking your insulin level. Not just your sugar, insulin level. A fasting insulin level or a HOMA IR score can be revealing. I had a patient, Ramesh, 35-year-old tech person from Gachibowli, thin, active, but constantly felt tired and had constant sweet cravings. His sugar level was fine, but his fasting insulin was 3 times above normal. We did dietary changes, strength training, better sleep, and guess what? His insulin level dropped, all without medicine. So what can you do? Here are 5 simple steps to reverse insulin resistance naturally. Walk for 10 minutes after every meal. This helps muscles absorb glucose. Cut down refined carbs, especially white rice, sugar, and packaged. Increase your protein intake, eggs, dal, paneer, or fish. They reduce insulin spike. Get 7 to 8 hours of sleep. Poor sleep worsens insulin resistance. Reduce your stress. Even 5 minutes of deep breathing makes a difference. Insulin resistance doesn't have to become diabetes, but you need to know early when you feel fine is when you should act. Start with your next meal, your next walk, your next good night of sleep. This is the first step in reclaiming your health before damage becomes visible. If this information helped you, share it with a friend or a family member who's struggling with weight, fatigue, or having excess sugar cravings. It could change or even save their life. This is Dr. Chaitanya, and you've been listening to The Silent Killers. See you in the next episode.